Hello, I'm Dr. Laura Pfeiffer. I am a naturopathic doctor and I work with women to help balance their hormones. One of the biggest things that I do with them to help them address their hormonal concerns is actually by dealing with digestive health. And the gut is really our first pillar in what we're trying to achieve in order to benefit their health. So today's video, I'm going to chat about stomach acid in particular, why it's important, how do we know the symptoms of high versus low stomach acid. I'm going to talk about treatment with proton pump inhibitors and why you may or may not want to consider this with a healthcare provider, what some testing for stomach acid looks like. I'm going to talk a little bit about medication and medication absorption, and then some really easy tips in order to improve stomach acid levels. So I just want to start by prefacing that this is all for educational purposes and is not intended to be taken as medical advice. It is important that you speak to your healthcare provider in order to make sure that you are creating a treatment plan that works best for you and that you are ruling in and out the important things that we need to look at when it comes to your digestive health. So let's just talk about stomach acid in general. I have my notes to keep me on track. If you have questions, you can always comment below on this video. So if we're looking at stomach acid and we're looking at how it impacts the digestive system, the pH of gastric acid, which is what we call stomach acid, is usually between 1.5 and 2. Now we have something called a proton pump that is in the parietal cell, and it helps make stomach acid. This is located in the stomach. What does stomach acid do? It does a lot of different things, but one of those things is it helps absorb nutrients. Some of those nutrients are calcium, iron, vitamin B12. It also helps absorb thyroid hormones. That's really important because let's say you're a person who has digestive issues and you have a thyroid issue. There may be a connection between the thyroid issue itself, but also possibly a connection between whether or not you're actually absorbing your thyroid medications adequately based on your level of stomach acid. It also prevents overgrowth of different bacteria in the gut because stomach acid is seen as a protective mechanism. Really, the acid level is supposed to help break down our food so that we can actually digest and absorb it, but it also is critical in preventing overgrowth, preventing opportunistic infections coming in and kind of staking their spot in our gut and wreaking more havoc. Things like H. pylori, things like C. difficile, as well as a ton of other things. It also, again, breaking down our food helps with reducing food allergies. So I find that in my patients, often it comes down to being a gut issue rather than a food issue. If a patient comes in and says, I'm just reacting to all of these foods, I'm not able to tolerate anything, it seems like these days, then I'm looking more to that being a gut issue rather than, oh, you suddenly have an issue with all of these foods. It typically comes down to being, well, is it a stomach acid issue? Is it an inflammation issue? What's going on in your gut that's not allowing you to deal with these otherwise really normal whole foods? When we look at digestion, it's really important to understand what phases we go through because this also will impact your ability to make adequate stomach acid. So the first phase of digestion actually starts when we think about food. So I want you right now to think about pickles. Think about vinegar, right? When we start to think about those things, you actually might find yourself salivating, right? This is the response to your body preparing for digesting food. This is why our senses are really important, and this is why it's extremely critical to be able to smell our food, right? We say we look at food, we smell food, and then we take it in our mouth and start chewing. So the process of digestion has actually already started once we've looked at that food. This is phase 1. Phase 2 is actually where the food is in the stomach. So this is where we're starting to break it down. And then phase 3, we move it through the intestines. But I think the most important thing that a lot of people don't realize is when we're actually looking at the food and smelling the food, this is part of our digestion process. And so we need to be in a rest and digest state. When is the last time you were eating something and you were in a rush, you were stressed, you were in the middle of work, you were sitting at your computer, right? That rushed state is not going to allow us to get into the space of resting and digesting. So that is one of the reasons why stomach acid is so important. Now, The second thing I'm going to talk about is it high or low. Now, this is where a lot of people are confused because a lot of times patients will be given what's called a proton pump inhibitor to treat their what's assumed to be high stomach acid, because if they have heartburn, they assume, okay, I have acid coming up here, so that means I have high stomach acid. But it's actually really difficult to tell whether you have high stomach acid or low stomach acid, because stomach acid is actually required for a number of processes. And what happens is if we have maybe a lot of abdominal fat, that can actually push things upwards. Certain foods can actually temporarily increase stomach acid, which can make us feel like we always have high stomach acid, but it could just be that particular food that causes heartburn. A lot of people will have heartburn in pregnancy because of the displacement of your organs, but also the progesterone. Stomach acid is actually required to help close this flap between your stomach and your esophagus. And so if you don't have that flap properly closed, that can also wreak havoc. And then we have to look at what sort of scenario are we eating our food in, right? If we're in a rushed environment, we're not able to make enough stomach acid in that particular scenario, and we may not be able to digest our food properly. So we're going to have gas and bloating, and sometimes things can end up sloshing back up. Some patients have diarrhea, some patients have constipation, some patients just have abdominal pain. If we think about it, if our food is not digesting properly and it's left sitting in our stomach, it's going to feel, you're going to be bloated. You might have some nausea, but also our digestive system is going to be irritated. So even if you have lower stomach acid, not the regular amount that we're supposed to have, your food's not breaking down as well as it should. But that food that's not breaking down very well is going to sit in your gut for longer than it should. And then what happens is, even though the stomach acid is low, the lining of your gut is going to be exposed to acid longer than it's used to, longer than it's supposed to. And that can lead to things like gastritis. And so it is really hard to pick apart, is it high or is it low? Because a lot of the symptoms overlap. And when we have low stomach acid, like I said, we can have the same types of symptoms. Typically with my low stomach acid patients, I am seeing things like gas and bloating after meals, nausea, maybe feeling like they could vomit or maybe actually vomiting, constipation or diarrhea. Heartburn kind of comes with the territory. And a lot of times we're seeing nutrient deficiencies, because part of the role of stomach acid is to help absorb nutrients. And so if we're missing that piece, we're not going to absorb that, or the nutrients that we consume, beyond also breaking down our food. I also see a lot of skin issues when my patients have stomach acid issues, because most things tend to come out on the skin eventually. And we see intestinal permeability, also known as leaky gut, when we are not properly digesting and absorbing our food. We end up having inflammation in our gut for whatever reason. Maybe it started, I always talk to my patients about the chicken or the egg. Maybe it started with an H. pylori infection. Maybe it started with something else. Maybe there's too low of stomach acid and then something came in and caused a little bit of inflammation. But what happens is we have spaces in between our gut cells, to put it really simply, and we have food that's not being optimally broken down. And so the exposure to our immune system is going to be very different for that food, and we shouldn't actually be exposed to the food in the way that we are, and this can cause us to have a lot more sensitivities, etc. And so this is why it's really important to get to the root cause and understand what exactly is going on. Now, a lot of people are treated with proton pump inhibitors for their stomach acid issues, or their assumed high stomach acid issues. And for a short-term solution, that can be a really good tool for some people who require it. But for the majority of patients I see, they've been on proton pump inhibitors for quite a long period of time. And I'm talking years and years and years, never reevaluated, never had a discussion whether or not it is a good thing to stay on long term. There are actual risks to being on proton pump inhibitors long term. So this is something that you should talk to your healthcare provider about. I talk to my patients about all the time. There is risk for increased fractures and falls, because of the reduction in absorption of certain nutrients. Like I said, there is a risk for deficiencies. There is a medication-induced hypochlorhydria. So we need to make sure that our stomach acid levels staying adequate. But when we shut off that system with a proton pump inhibitor, we are shutting off the system altogether, and we're likely putting ourselves into a state of too low of stomach acid, which again is going to stop our body from preventing infections and overgrowths and things like that. And so long-term proton pump inhibitor use is not a great idea for the majority of patients. And so talking to your healthcare provider about what the next step is. Now, I think there is a really good time and place for using pharmaceuticals in a lot of different spaces for a short-term intervention. A 3-month plan, let's say, with other methods to go about treating the concern, and then talking about kind of walking back from that medication depending on what the concern is. So with a proton pump inhibitor, the best clinical intervention is actually diet, lifestyle, and patient education, so they know how to help with their symptoms. But when we just throw a proton pump inhibitor at the patient and then say, have a nice day, let's see if that works, it's not really doing the patient a service. So we need to make sure that when we're recommending these things that you're reevaluating after 3 months. Where have we gotten? Because there is a risk of not only low stomach acid while you're on a proton pump inhibitor, but a rebound high stomach acid when you come off. And so what often happens is patients will be on a proton pump inhibitor, and then they will just go off because they say, well, I don't want to be on this anymore, or I want to see if things are fixed, or whatever the other reason is. And they automatically have really bad heartburn, and they say, oh no, I need to be back on this. And so talking to my patients about how we walk through that discussion of, weaning off of it slowly. I often will refer them to their medical provider, whoever prescribed it, and say, it might be a good idea to talk about how to walk off this slowly so you don't have this rebound effect that is bound to happen when you come off of this medication. And so I guess coming back to, how do we even know we have stomach acid issues, high or low? This is the tricky part. There is some testing we can do. My notes are always unorganized, but this is how I have the best conversations. So when we're looking at testing, there are some tests that we can do that are validated and really actually quite good. The problem with these tests is they're quite invasive and they're expensive. And so the typical person who presents with digestive symptoms, some bloating, maybe some undigested food in their stool, maybe they're gassy, maybe they have a bit of heartburn, they're probably not going to be investigated for this, for good reason. The doctors aren't going to go do invasive testing unless they feel that it's absolutely necessary. So if you want to chat about those options with your doctor, I would recommend you talk to them. But more, functional ways to test is typically what I do with the majority of my patients, because the population of patients I'm working with may or may not need more invasive testing, and we will discuss that on a one-on-one basis. But there are a lot of options online about, more natural ways you can test for stomach acid levels. Now, I'm going to preface that there isn't a ton of research behind these methods, and a lot of what I'm doing is based on a clinical symptom picture, based on a patient's risks, and based on their history, and seeing what am I worried about, what sort of testing do I want to refer them to. Some of my patients have had endoscopes. Some of my patients, I say, well, we need to do a colonoscopy, right? We have to understand that it is a whole picture, and I want to make sure everyone is being seen by the appropriate care provider. But I just wanted to talk about some interesting pieces. So one thing that is a big deal when you're on proton pump inhibitors is the hypochlorhydria, so the low stomach acid. And the problem with that is that you're not going to actually absorb certain medications need to be absorbed at a certain pH level. And the problem with having consistent medication that's increasing your stomach's pH is going to be a problem for some medications. So one study I actually looked at was looking at taking betaine HCl, so it's an over-the-counter supplement, to help lower acidity, or basically make the stomach more acidic in order to absorb those medications with people who were on a proton pump inhibitor. So in this study, I just want to preface, they took healthy individuals and they gave them a proton pump inhibitor. So this study is not concluding that it is safe or recommended for individuals who are already on a proton pump inhibitor because of certain reasons that they've discussed with their medical doctor. But I'm just giving an example of something you might possibly want to talk to your doctor about, because you can actually look up medications and see what pH medications need to be absorbed at. And it might be the case that some medications that you're taking need a acidity level that your proton pump inhibitor is impacting. And so this study, they actually looked at taking betaine HCl, and these individuals took it. It took effect in about 6 minutes, meaning it lowered the pH, lowered the acidity within 6 minutes, and it allowed these individuals to absorb drugs that needed a lower pH, which is just really interesting. And so they concluded that this intervention, they could actually make it so that people who needed to take certain medications at a certain pH could take betaine HCl, followed by their medication within about 10 minutes or so, and actually confirm adequate absorption. Like I said, not good for everyone, depending on what your pre-existing medical history is. Now, if we're talking about testing stomach acid levels from a more functional perspective, that isn't the invasive testing, because the invasive testing, not everyone has access to, and not every doctor is going to recommend for you. There are a few different methods. One that's commonly found online is called the betaine HCl challenge. The premise behind it is that you would take 1 capsule of betaine HCl at dinner, making sure you're having protein with that meal. The next day you would do 2 capsules with that high protein dinner. Next day you would do 3 capsules. Basically, you would just continue on until you got this burning sensation, which in theory would suggest that you go down from the number of capsules, and that would be the number that is right for you to get your stomach acid levels to come up, basically. Now, the problem with that, so as an example, if you got to day 3 and you took 3 capsules and you got that heartburn or that warming sensation, you would go down to 2 capsules, and that's your technical dose. There's a few problems with this method. Number one, it's not evidence-based. And so, a lot of the things we're kind of taking more of a theory and kind of an evidence-informed decision rather than a evidence-based randomized control trial type of situation. Although we do have some evidence with the medication absorption, we don't really have evidence with this challenge. Some problems are that if you took 1 capsule and you got, let's say, some burning, the conclusion would be that, oh, your stomach acid level is adequate. You are good. The problem is this doesn't take into consideration that you could actually have mucosal damage in your stomach, that betaine HCl is worsening. And so if you are a person that finds yourself taking a digestive enzyme that has HCl in it, or betaine HCl, and you find yourself having burning or heartburn, this could indicate that you have some inflammation in the gut. How do we get inflammation in the gut? Could be because of chronic poor digestion. So like I said before, even if your stomach acid is low, you're having trouble breaking down foods. Those foods are going to sit for longer, leaving your stomach to be exposed for a longer period of time to some form of acid when it's not typically meant to be exposed for that level of time. The acid's going to be sitting there even if it's low. And so that's a problem, right? Low stomach acid can also lead to delayed emptying, right? This is what I'm talking about. And so this is where the challenge would be not a good thing to do, because you're just worsening that mucosal damage in your digestive system. In that case, it would be important to do some digestive healing and building back up before dealing with the stomach acid challenge, right? And so I think that's one of the things we really get wrong when we start to do things like that. Another test is called the baking soda challenge. The baking soda challenge, again, not evidence-based, but it is inexpensive and it is relatively safe. The idea behind it is you mix baking soda with your stomach acid, and that creates CO2, which is going to cause you to burp. And so what they would typically recommend is, on an empty stomach, the recommendation is about half a teaspoon of baking soda to 4 to 6 ounces of water. Drink it on an empty stomach, timing the amount of time it takes for a burp to happen. If the burp is anywhere between 3 to 5 minutes, it's typically seen as normal. If it takes longer than 5 minutes to burp, or there's never a burp, it's considered low stomach acid. Again, this isn't super evidence-based, but it's not an invasive test. It's not an expensive test, and it typically will not cause the irritation like the betaine HCl challenge would. Now, some more functional blood work we can look at to identify, like I said, when when I'm working with my patients, I'm typically doing a full intake, and I'm using their symptoms in combination with their history, and we're really deciding on what sort of testing makes a lot of sense. And so we may incorporate some of these more functional, less evidence-based techniques in order to further our, preconceived thoughts about what's going on, but we may not do any of this. Some blood work that can be helpful in determining if you have low stomach acid. If I see a patient who has chronic deficiencies, chronic vitamin D deficiency, B12, iron specifically, you can also look at low phosphorus. That would be indicative that something's not being absorbed. Specifically in my patients who are taking B12 and iron and vitamin D and things just are not being absorbed, that can be a red flag for me. Other blood work we can look at is serum chloride. And typically, if your chloride is low, we are saying you have stomach acid levels, because chloride is one of the components of stomach acid, really. It maintains healthy acid-base balance. And so if it's low, we are saying that, oh, you don't have a lot of stomach acid. Again, more of a functional test, not super evidence-based. I couldn't find literature on that to connect those two pieces. And abnormal serum protein and serum globulin levels can identify whether you are potentially having low stomach acid levels, because stomach acid is needed for protein digestion. So again, these can be helpful on top of your clinical intake because they're really inexpensive blood tests. So if you're already doing blood work and there's like a $3 test we can tack on to kind of solidify our understanding of things, it might be something that we could do that would be helpful. Now, how do we increase stomach acid? I would always recommend that you talk to a healthcare provider, because a lot of these topics can become really complex when it comes to stomach acid and digestive issues, and identifying the biggest thing is ruling out the big things, identifying what testing we need, and how to move forward from that. So some really easy dietary things that can be helpful for stomach acid levels is relaxing during meals. So getting that rest and digest nervous system up. Fermented foods can be a helpful tool for helping to normalize digestive function, as well as things like ginger and apple cider vinegar. For more intensive or supplement protocols, I would recommend you work with a healthcare provider. And I would also recommend you speak to your medical doctor as well, or your naturopathic doctor, if you are looking for what testing would be right for you, or what sort of tools we can use to improve your digestive function, because better digestion equals better hormones. See you guys next time. Thanks for listening.